My name's Adam and I'm joined by Elise and Abdulai. The purpose of our video today is to analyse the socio-cultural factors that contribute to health inequality in society, particularly southwestern Sydney. This issue is dementia.
What is dementia? Dementia is a collection of symptoms that cause disorders affecting the brain. It is not specific just to one disease. Dementia is a decline in the mental ability as well as affecting thinking, behaviour and the ability to perform everyday tasks. Dementia is not a normal part of ageing. Modifiable factors that influence dementia, such as not smoking, drinking less than the average standard amount a week, exercising regularly and making sure to keep your blood pressure at a healthy level. Non-modifiable factors include age and genetics, and 10 thwarting factors include memory loss that disrupts daily life, challenges solving problems or planning, difficult completing familiar tasks, confusion with the time or place, and trouble understanding usual images or spatial relations. New problems with words in speaking or writing, decrease of poor judgment, and withdrawal from work or social activities.
Sociocultural factors that affect health inequality in Western Sydney. So SES, low socioeconomic status, no access to medical care or nutritious food, health gains have not been equally shared across the New South Wales population. Education also plays a role, so lack of education on health. Employment, for example, in the year 2012, 26,873 adults were unemployed in southwestern Sydney region. Indigenous, so the belief, behaviours, lifestyles that all play a role in health, in an individual's health. Geographic location, rural, remote, insufficient access to healthcare and social care. Health status of southwestern Sydney residents. There are high numbers in psychological distress within the individuals affected by dementia, so the elderly. There is an adequate percentage when it comes to physical activity at 47.8% within the elderly community. Prone. Dementia in Australia is much higher in women compared to men. Women at 7,277 while men are at 3,656. Leading underlying causes of death by sex. According to the New South Wales Health Western Sydney District, 2016, approximately 9% of Australians aged 65 and over are diagnosed in dementia. In people aged 85 years and older, this figure rises by 30%. As Australia's population ages, the number of people with dementia expands and increases.
In conclusion, the Southwestern Sydney Local Health District covers a number of large local government areas, both rural and suburban, each with varying socio-cultural issues such as socio-economic status, employment and education, all of which play an important part in a person's health. Research suggests that because of these factors and an ageing population, dementia, a disease that affects thinking, behaviour and the ability to perform tasks, is becoming more prevalent as we get older. There are currently over 410,000 people diagnosed with dementia, and this is increasing at approximately 244 cases per day. It is expected by the year 2025, only 8 years away, Australia will need in excess of 375,000 workers to cope with the number of dementia patients, at a cost in excess of $18.5 billion. We cannot stop dementia from happening because it is impacted by our age and genetics, but there are some steps we can take to reduce the likelihood of dementia. These are by not smoking, minimising the consumption of alcohol, maintain a healthy diet, and lastly, exercise regularly.